One of the many incongruities to emerge from the 2020 Psy-Op was the popularization of the drug known as ivermectin. It was first launched as a veterinarian antiparasitic drug in 1981, widely touted as a cure-all by opponents of the official narrative concerning that year's dominant strain of cold virus. But it's also been variously described by proponents as a cure-all for human cases of diseases ranging from malaria, flu, RSV, and even cancer. The major pharmaceutical company Merck was the first to develop and commercialize ivermectin, which was originally introduced as a medicine for animals like sheep, pigs, horses, and cattle. But by 1987, it was being used to treat river blindness in humans. According to PubMed Central, it's widely recognized as a wonder drug for its reported success in treating millions of people suffering from parasitic diseases, especially in the developing world. Now, the contention behind ivermectin during the lockdown was that it could be used to fight a COVID infection. Those claims were largely based on a June 2020 lab study that suggested ivermectin could inhibit the COVID virus in a petri dish in vitro. Of course, the left-leaning news media responded by roundly condemning those who embraced it as a COVID killer, instead using their platforms to shill for the officially designated treatment for that year's cold virus. But what this actually did was keep Americans divided in the left-right paradigm while promoting the idea that Big Pharma ultimately has the answer to anything that might ail us. And this, I believe, is where ivermectin was intentionally brought into the COVID conversation in order to keep the right wing, that is, wedded to pharmaceutical-grade drugs as medical treatments instead of natural medicines like dieting or herbal remedies. Now, to further underscore this point, common side effects of taking ivermectin include dizziness, nausea, diarrhea, stomach pain, skin rash, and joint pain. And according to the Mayo Clinic, high doses of the drug can lead to severe toxicity, including confusion, seizures, coma, and serious neurological issues. Other serious reactions, including fatal ones, have also been associated with high-dose use. By touting the supposed benefits of ivermectin, the right was perhaps unwittingly playing into Big Pharma's hands by promoting the idea that drugs are the answer. But if nothing else, it kept conservatives in lockstep with the drug pushers, which in turn keeps them vulnerable to future psyops involving federal mandates and modern medicine. So the next time you hear someone singing ivermectin's praises, keep in mind that that drug is certainly no different than any other chemically based remedy sold by the usual suspects. This is South Bay. Thanks for listening.